Mental health advocates have accused the federal government of not taking patients' needs seriously. Temporary changes to the mental health policy will see some funding restored. But the AMA says the changes don't go far enough.
Demand for mental health services in Queensland is on the rise, but hospitals are struggling to cope.
People presenting at emergency departments and, unfortunately, people being turned away from mental health units at the hospitals because there simply aren't enough beds.
But instead of services being expanded, they've been reduced. Last year, the federal government cut psychological services in the Better Access to Mental Health program by 44%. Mentally ill locals were left in the lurch.
It made it harder for people to get referred to psychologists, and they made less visits for people when they see psychologists.
Mounting pressure from within the health industry has resulted in the decision being recently revised.
Well, they took the funding away from us to start off with, and now they've replaced it with less funding than they had there in the first place.
The AMA says temporary changes don't go far enough.
It appeared that what was happening before was required because people were using those services, and that would suggest that they were certainly required.
Advocates have vowed they won't stop fighting until mentally ill people are treated with the same priority as physically ill patients.
We have to look at the broad picture here, not just trying to cut costs and cut corners, for the sake of a budget surplus in 2013.
Grace Tobin, 7 News.